Reducing blood pressure can be a very challenging task for those suffering from this condition. However, with determination, adopting healthy habits, and medical supervision, it can become a less difficult task. What is hypertension, high blood pressure? Hypertension, commonly known as high blood pressure, is a silent disease that can affect men, women, and even children. Blood pressure is simply the force that blood exerts against the walls of the arteries to circulate throughout the body. A person is considered hypertensive if their resting blood pressure is above 140/90 mmHg. The ideal value should be around 120/80 mmHg. Blood pressure can fluctuate and rise slightly in situations of stress, agitation, or physical exertion, so if a person consistently has these numbers at rest, they should seek medical advice as soon as possible. How to reduce blood pressure? To reduce blood pressure, a medical evaluation is necessary. In some cases, depending on the severity, the doctor may suggest only lifestyle changes to address the condition. However, in most cases, medication will be needed to relax the blood vessels. What should the patient do to lower blood pressure? Take the prescribed medications at the correct dose and time. It may seem obvious, but many people stop taking their medication just because they measured their blood pressure and found it normal that day. Skipping medication is the worst thing that can happen to a hypertensive patient. Adopt healthy habits. Those with high blood pressure should change their diet, reduce the intake of processed foods, cut down on salt, avoid smoking, and engage in physical activity. Lose weight. People within their ideal weight, considered healthy, can also suffer from high blood pressure. Don't think this is only a condition for overweight individuals. It can affect anyone. But if you are overweight, seek guidance to lose weight. It is proven that for every kilogram lost, blood pressure can drop by 1.3 to 1.6 millimeters of mercury. Change your diet. A healthier diet, free from processed foods, can contribute significantly to lowering blood pressure. Quit smoking. Smoking is one of the biggest enemies for those trying to lower blood pressure. Try to quit this habit for good. Foods that help reduce blood pressure. On this site, we have already mentioned several foods that are beneficial for lowering blood pressure. Avoid stressful situations. Stress is a strong trigger for high blood pressure. Avoid situations where you know you'll get upset. Sometimes it's difficult to avoid problems, but your health must come first. High blood pressure is a disease that shows no symptoms and can appear out of nowhere. For this reason, even if you don't have a family history of it, you should have your blood pressure checked by a doctor at least once a year. If you do have a family history of hypertension, you should check it more frequently. The sooner you discover the condition, the sooner you can begin treatment and avoid serious consequences for your health.